Dr. Leana Wen. Thank you for joining me once again, Doctor. So the idea of, no, you still shouldn't travel even with the vaccine. Do you think that's the right call?
I do not. Look, I do understand the situation that the CDC is in. They want to be cautious, and I do have sympathy for that. They don't want to overpromise initially and then have to dial it back. But I also think that there is a cost to saying things that don't meet the common sense test. Air travel, for example, alone is very low risk when everybody is wearing masks. And if somebody is vaccinated, that risk is lower still. The risk, actually, I would be concerned about unvaccinated people who are traveling, going on spring break, going to lots of bars and hanging out and spreading it to one another. I'm not concerned about the vaccinated grandparent who's traveling across the country just to spend time with their extended family. And I think that kind of nuance really needs to be spelled out, or else it's not going to make sense to people, not meet the reality test.
So you have messaging here being balanced with risk because, as you've laid out to me earlier today on the radio show, which is why it's so important for me to have you here tonight to echo it onto this audience, we're in a race, you say, and that we won't always have less supply than we do demand, that we're going to have to motivate people to want this vaccine, and it may not be as easy as people suspect. What do you believe that race is, the variables are, and what the messaging should be?
My main concern is that we're not going to reach herd immunity because of vaccine hesitancy. And I know that's hard for a lot of people to believe who desperately want the vaccine right now. And they're thinking, oh, well, it's just a small percentage of people who are actually anti-vaxxers. And that's true. There is the anti-science, anti-vaxxer contingent. But I think that there are many more people, millions of people who, for whatever reason, have concerns about the vaccine, who just don't know what's in it for them. And we need to make it clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. I mean, you were mentioning, Chris, about how all these states are reopening. They're reopening at 100%. And we have a very narrow window to tie reopening policy to vaccination status. Because otherwise, if everything is reopened, then what's the carrot going to be? How are we going to incentivize people to actually get the vaccine? So that's why I think the CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things. Here are all these freedoms that you have, because otherwise people are going to go out and enjoy these freedoms anyway. And I fear a situation of coming into the fall where we never reach herd immunity, and then we get hit by the next surge of COVID-19 in the fall, something that we could have prevented if we just got people vaccinated now.
Dr. Wen, so the federal government, we have seen since the pandemic set in, has had authority over air travel and air and rail when putting in requirements for wearing masks now for more than a year we've seen. They're not making a vaccine requirement for air travel or train travel in this announcement from the president. Do you think there should be that requirement, and how big of a difference do you think that would make?
I absolutely think we should have that requirement. I think it was a major oversight on the part of the Biden administration to not issue this yesterday. And we have to talk about the reason. The reason isn't so much that we need to keep our train travel and plane travel even safer. They are pretty safe, although I definitely think that having a vaccine requirement would make it even safer and probably encourage many people who are vaccinated or who have young kids and want to protect them. Maybe it'll help to encourage those people to start traveling again. But there's an even bigger reason too, which is I think we really need to make it clear that there are privileges associated with being an American, that if you wish to have these privileges, you need to get vaccinated. Travel and having the right to travel interstate, it's not a constitutional right as far as I know to board a plane. And so saying that if you want to stay unvaccinated, that's your choice. But if you want to travel, you better go get that vaccine.
Let me begin with you, Dr. Wen, and that is what Bill Gates just came out and said this morning, that we could, in his estimation, be, quote, entering the worst part of the pandemic. That is stunning, especially given that not enough, but a number of people are fully vaccinated and boosted.
I think what we will see with Omicron is a very large number of infections due to COVID-19. The question, though, is are we going to see a decoupling of infections with hospitalizations and death? That would be ideal. The entire point of vaccination, the main point of vaccination, I should say, is to reduce severe illness. And so if we're able to avoid overwhelming our healthcare systems, that would be the goal. Are there going to be a lot of people who get Omicron? Absolutely. But the hope is that enough people have been vaccinated, certainly in some parts of the country and many parts of the world, that we're going to prevent the worst of it. Now, I do have a lot of concern about what happens to parts of this country, for example, that have very low vaccination rates. And this is another reason why I think President Biden's message yesterday was the right one in some way, in saying vaccinated people should move on with their lives with precautions. But I wish that he would go further to restrict the activities of the unvaccinated, because they are the ones who are still spreading COVID and prolonging the pandemic for all of us.
Frankly, we know that we can't trust the unvaccinated. We can't trust the unvaccinated. We can't trust the unvaccinated. We can't trust the unvaccinated.